Arabia. I'm going to talk about placebo effect. Actually, it's from the listening.
Press display image.
Okay, sorry. Yeah, hi. My name is Layla. I'm going to talk about the placebo effect. Actually, it's from the listening book that we're studying now. So I'm going to talk about what's the placebo effect and the placebo itself. Placebo is the treatment made by non-chemical substance. Usually it's a pill or a shot or a capsule. And the placebo effect is the change of health condition noticed after giving the placebo. Which means if I have like a research study, and I have two groups of people. First one, I'm going to give them the real medicine, and the other group, I'm going to give them the fake or unreal medicine. And I'm going to see the changes that going to happen or appear for the patient and his condition. And then I'm going to talk the history of placebo. The first one who introduced the term of placebo effect was William Cullen in 1772. But also the first one, before him, there is Alexander Sutherland who started to think about the placebo effect. But the first documented research was in 1785. And then later on, it became the key understanding for healing through medical rituals. How does the placebo effect work? Like studies are used to help researchers to know the effect of drug might have on the patient and his condition. Despite that, the placebo is unreal. Many studies showed some physical changes occur to the body. Example, the reduction of endorphins will occur and make the pain go away. And this endorphin is the brain give orders to produce it more in the body. And the patients who take placebo regularly notice a health improvement than those who doesn't follow instruction or schedule. The purpose behind the use of placebo. The main purpose is to study the relationship between the mind and the body and how does it work. If the patients think that the treatment will work, it's possible that the drug will work. What can affect the treatment? Many factors could affect on the placebo. For example, the color of the pill. Many studies show that if the pill is blue, they give it for the people who have disorder in sleeping, and they give blue pills for the the people who feel pain diseases. And also, if the researcher or scientist make sure to tell the patient that it's harder to obtain, and it's the value of the medicine, that it's really uneasy to have it, or it's uneasy to have it and give it to you. And also, if they say it's expensive disease, these three reasons might help them. These three reasons might help in results of the research. Also the region. Many people think that if it's like in Europe, for example, if they're gonna treat ulcer disease in Germany, it will work, other than Europe. And if they, like for hypertension, if they use, it will work in Europe except Germany. In both ways, they are unreal. And also it can affect, if the patient have positive thoughts, the treatment might work. And also if he have negative thoughts, the treatment won't work and will have the side effects of pain or headaches or whatsoever. So these are my questions. What's the placebo effect?
Good and bad.
Should I go back?
The effect after the medication.
Yes. Correct. So effect of the medicine if it's not real. Also, when was the first documented study?
72. 85,
yeah. Why does the placebo effect studies are done?
To know the positives and negatives.
Yeah, to know the relationship of the body and the mind. Yeah. Thank you.